Welcome. It's great that you could join us today. We are doing self-care strategies for healthcare workers, which is the first of 3 webinars presentations that we will be doing. We're actually going to take a few moments to introduce myself and the other panelists that are on this webinar. My name is Thérèse Lawlor, and my background is social work and long-term care administration, with over 30 years experience working in geriatrics in both clinical and management positions. I've worked in the area of long-term care, developmental disabilities, adult day programs, acute care, primary care, complex continuing care, community care, and psychogeriatrics. Currently, I am the Psychogeriatric Resource Consultant with the Scarborough Health Network and the Regional Geriatric Program of Toronto. Charlene Marshall is a clinical social worker with many years of clinical experience in the fields of geriatric mental health, addictions, and forensics. She is currently a psychogeriatric resource consultant with the Centre for Addiction and Mental Health and the Regional Geriatric Program of Toronto. She also teaches at Humber College as a part-time instructor. Tony Schembri is a PRC with the Regional Geriatric Program of Toronto and the Scarborough Health Network in the Central East Lynn. Tony combines 25 years of experience in mental illness, acquired brain injury, with 2 graduate degrees in education and in psychology. Today we're going to talk about the self-care strategies for you, the healthcare workers. This webinar acknowledges the impact that COVID-19 is having on the frontline healthcare workers. We are asking you to give yourself permission to take care of your mental health and make yourself a priority. What we're providing today is one-stop shopping to the most appropriate self-care strategies that work for you. Please note, this webinar is not intended to be a substitute for professional medical advice. This webinar is using a knowledge to practice framework, which provides relevant content and resources. Please keep in mind there are many helpful clinical services made available for frontline healthcare workers to assist with the mental health impact of COVID-19. Goals for today. We have a self-awareness check-in, physical and emotional impact of working in a COVID-19 environment, changes of the mental health phases over time, and navigating the available resources. Understand the COVID crisis has put all of us under stress and increased pressures in all of our lives. For the first time in our lifetime, we are dealing with a pandemic. It's important to pay attention to how the COVID-19 has influenced us on both a professional and personal level. Acknowledging this helps us build resiliency and skills to manage stress and to cope with the anxiety created while working in healthcare during the COVID-19 crisis. Some housekeeping. Typical questions we do get asked is, will we get the slide deck and the tip sheet, which will be shared with you shortly after the training. This webinar will be recorded and posted on the RGP Toronto YouTube channel. Please type your questions related to the content into the chat. There will be opportunities for questions and answers at the end of the webinar. We'd like to ask some standard poll questions. To find out who we have in the audience. Well, our first poll is, what is your role? If you could please click on what your role is. So in the audience, 13% are in nursing, 13% are in physiotherapy, 13% are social workers, well, this is an even split here, 25% are PRC, 13% administration, and then 25% other. How many years of experience in the field do you have? Please click on the one that applies. %, is 0 to 5 years. 16 to 20 years is 50%, and 21 plus 38%. There's quite a lot of experience in our audience here. And our last question, poll question here, is have you attended previous webinars in this series? So 33% yes, and 67% no. As you can see in front of you is a roller coaster. So when we imagine going to the amusement park to ride the roller coaster, we're often filled with excitement and anticipation as to what the ride will be like. When we board the roller coaster and are sitting and looking at the twists and the turns ahead, we have some indication of where we are heading. However, if we're going on the backward roller coaster, which is very much like the Corona coaster, we can't see the twists and the turns, and this often leads to increased anxiety and fear. We begin to wonder, are we sitting in the right seat? Will the coaster be veering to the left or to the right? Will the coaster enter the loop, and will we go upside down? What is happening next? There's a message from the World Health Organization to all healthcare workers. Feeling under pressure is a likely experience for you and many of your colleagues. It is quite normal to be feeling this way in the current situation. Stress and the feelings associated with it are by no means a reflection that you cannot do your job or that you are weak. Managing your mental health and psychological well-being during this time is as important as managing your physical health. As you can see in front of you, the picture of many different disciplines that are actually working through this very difficult and trying time. We hope that we'll be able to provide you with strategies and resources to assist you with your self-care and support your coping skills. We also hope to provide you not only with the opportunity to self-reflect, but also with a way to check in with yourself. After all, we are all in this together. I'm going to pass this now over to Tony.
Hi, everyone. It's Tony. So please take 1 minute to reflect on what Thérèse had said and how you feel while privately focusing in on your feelings and emotions, which may surface. We're going to take a poll, and please check all that apply within the poll. You'll see the poll appear on your screen. Please take a moment to complete, and then we will review. It's interesting to note during this poll, people predominantly at 70% selected anxious and grateful at 30%, mostly bored at 10%, optimistic, which is good, at 10%, depressed at 30%, normal at 10%, untroubled 0%, and numb at 10%. That's really interesting because the Angus Reid poll that asked Canadians to feel the way that they felt as well. A lot of people turned out that they were worried and anxious, predominantly in larger groups. And grateful was 34%. That surprised me as well. 30 were bored. Optimistic came in at 19%, and depressed was 16%. Normal and untroubled were 14 and 11, while numb was 9, and pessimistic was 9%, which is really good because I would have thought pessimistic would have been the largest number, and other was 7. It's important to appreciate all Canadians generally have been impacted by the COVID-19 crisis, and our current poll seems to fit with the Angus Reid poll. We're going to be looking at the stages, and this webinar focuses in on the early stages. So fear, anxiety, and distress. Eventually, we will be leading into the mid to late stages, which addresses burnout, fatigue, grief, and substance use. And we will address this in webinar 2. And in our third and final webinar, we'll be looking at addresses post-traumatic stress symptoms, depressive symptoms, and substance use. In our research, there was discussion of the ABCs of stress. And I got to tell you, they're all interrelated. I'll give you a general example of how interrelated they are. I'll start off with C. My friend did not call me last night. B. I called the hospital, police, and fire department looking for my friend frantically. And A. My friend does not care for me anymore, or my friend had a bad accident. A COVID-related example of this is I don't want my family to be infected by this virus, C. I try to triple and quadruple my glove to protect myself, B. And A, I'm fearful of this invisible and viral threat, and my thinking is compromised. The WHO has come up with some very good, pictures, or to really root us and to give us an idea of where we are at in dealing with this COVID-19 pandemic. So it's really interesting that we can find growth. The diagram is broken out into 3 zones, and it's fear, learning, and growth. Although this process may appear linear, it's not really linear at all. There will be times where we experience more fear and other times when we experience more growth. Remember, it's important that we are gentle and compassionate with each other and ourselves. The World Health Organization uses this diagram to kind of give us hope that there is actually from fear and learning and growth. The fear zone is mostly about panic and alarm. I grabbed for things for safety, comfort food, and who remembers the toilet paper pandemic early on? Medication, all that I may not really need, but because I'm in fear, I'm panicking. I'm complaining more, and my anger seems harder to contain. In the learning zone, I start to understand to give up what I can't control. I can identify that I am upset about my situation and other possible implications. As an example, I could limit the watching and taking in of sensational news and content and increasingly disturbing news to instead seeking out information which is far more balanced. And finally, zone 3 is the growth zone. I live in the present and reasonably evaluate while taking things easier on myself. I volunteer and I help by making my skills and talents available to others. I take time to appreciate others and look at how to adapt with this situation. Lastly, and most importantly, includes the practice of listening, patience, relationships, and our own creativity. Keeping in mind, again, this is not linear, but it's also not a cookie cutter approach, as each one of us will experience these things uniquely to who we truly are. Charlene is going to continue on in what's going to follow next.
Thank you, Tony. This slide here speaks to the common reactions during the beginning of the COVID-19 pandemic. So this slide shows those little emojis, some various emotions that healthcare providers have acknowledged. So things like, why are we not getting more supplies? Why are these people not staying home? Do you know what I would pay to binge on Netflix and complain about my kids? The purple emoji talks about, I miss my friends and family. All this suffering is a lot to cope with. I care so much for my patients. The blue face talks about, I don't want to be exposed or expose someone I love. I am afraid to lose people I love. There is so much uncertainty. And the pink emoji, I know it might be hard to see there, talks about all of these signs of support from the public and my family make me proud. I am happy to be contributing. Let's do a happy dance. Somebody has recovered. And this is taken from a really wonderful resource, Psychological First Aid, and we've referenced it at the bottom of this slide. In terms of the crisis, we frontline healthcare providers, the next slide, we're ramping up to the crisis. So these were some very unique challenges that healthcare providers found in terms of working in unprecedented times and actually doing amazingly under very difficult circumstances. So one of the common reactions has been anticipatory anxiety. What if? A feeling of being overwhelmed, a feeling of frustration with decision makers, the system, the healthcare system, the politicians, irritation with communication issues. There's a sense of a perceived lack of control, lots of uncertainty about roles, tasks, or what guidelines apply, general healthcare versus general public health guidelines. And lots of information overload, oversaturation, particularly at the beginning of the COVID-19 crisis. On the next slide, we are now in the thick of the COVID-19 crisis, and these are some of the common reactions that have been noted by healthcare workers. Stress related to trial and error in dealing with an unprecedented event, learning as we go, sleep problems, anxiety, feeling conflicted between responsibilities and obligations in our professional lives, our families, and in our community. Tensions with co-workers, tension between professions, specialties, hierarchies, us versus them, the general public versus healthcare providers, ethical and moral dilemmas, a feeling of helplessness and exhaustion, difficulty meeting the demands of the workload, fear of infecting self or family members, anxiety related to knowing colleagues who are infected at work, and being in the go mode, task-oriented survival mode. The next slide speaks to some other feelings that people have experienced when the dust begins to settle. So this feeling of detachment, irritability, feelings of exhaustion, the recovery period, the potential for trauma-related reactions, for instance, post-traumatic stress disorder, depression, and anxiety. Potential growth and lessons learned, which is what Tony was speaking about earlier. So, yeah, in our next slide, we are going to give you the main takeaways of the COVID-19 crisis for unique challenges of healthcare providers. If you are experiencing stress and exhaustion, You are most likely a normal human being with a nervous system and a brain. Welcome to humanity. Your reactions to COVID-19 are most likely not going to be linear or static. You may experience a back and forth of these experiences, sometimes feeling on top of it, and sometimes feeling like you are struggling to catch up. Hence the importance of checking in with yourself. And we've provided the link here for the COVID-19 workbook that Tony spoke about that as well, the opportunity to self-reflect and to take a pause. This slide, we have a wide variety of resources for both anxiety and stress. Some of these resources are reading material workbooks, as well as direct links to professional clinical services as needed. And in our next slide, we have a few more. So we would strongly encourage you to, when you have some time, take a look at the resources provided. They're very helpful, and they're specifically dedicated to healthcare providers during the COVID-19 crisis. This is a key strategy that we discuss when we talk about our thoughts. So this is called the ABCDE technique attention. So really, when we're feeling distressed, it's really important to stop what you're doing. And on that note, it's about paying attention to your inner dialogue. What is your mind telling you? And the B stands for believe. Do you automatically believe your thoughts? The C stands for challenging. Diffuse anxiety by broadening your focus. What's the bigger picture? Is the thought fact or opinion? What might you think if you were feeling calmer? The D stands for discount. Acknowledge that anxiety has been dominating your thinking and let the unhelpful thoughts go. E stands for exploring the options. What would be helpful to focus on right now? What options do I have available? So this is a very helpful technique, and I shared in the webinar this morning that I found, continue to find COVID-19 crisis very stressful, and I took a mindfulness course over the past 3 months actually, and number one is paying attention to my inner dialogue, and it has really helped me by acknowledging with self-compassion and no judgment what I am thinking. And then I'm able to work through B, C, D, and E. But the first step is I need to slow down to pay attention to what I'm actually thinking. And we've got another technique that speaks to this as well. On the next slide. The think technique. The think technique is taken from cognitive behavioral therapy, and it's a little more in detail. So the first thing is true. Is this thought 100% true? If not, what are the facts and what is opinion? The second part here is helpful. Is paying attention to the thought useful to me or others? The next part here is inspiring. Does the thought inspire me, or does it have the opposite effect? Necessary. Is it important for me to focus on the thought? Is it necessary to act on the thought? Kind. Is the thought kind? If not, what would be a kinder thought? And the idea here is to work through this, this technique, and you can do it by writing or typing your thoughts. I kept a journal actually, and I continue to keep a journal. And there's also some free cognitive behavioral therapy thought diary apps that you can get through the Google Play Store or the iTunes Store. But the big takeaway here is if you're not used to paying this much attention to your inner thought, inner dialogue, thought challenging might feel unnatural at first. That's okay. Over time, it will get easier. This isn't the most appropriate tool, though, if you're feeling very distressed, as it can be hard to think rationally when your emotional brain has taken over. Try diffusing your emotions with a distraction activity and returning to thought challenging once you're feeling calmer. And again, we've given the citations. If you're interested, you can follow up at the website there with more details on this think technique. So the next slide, we are going to review again the changes in mental health burden over time. And today we're addressing the early phase, fear and anxiety, distress, depressive and anxiety symptoms. And we will be having 2 more webinars that will address the mid-late as well as the after post stages of changes in mental health burden over time. So please stay tuned. There'll be 2 more upcoming webinars very shortly. So we'd like to take this opportunity to ask you if this was helpful. And also, are there other topics that you would like to see? And we would encourage you to use the chat box. Certainly, you know, what topics would be useful as well for you as healthcare providers as you move into the recovery reopening phases of COVID-19. I've heard from a lot of healthcare providers that there are a lot of concerns about a possible second wave, families resuming visits. And the other thing we'd like to hear from, have you discovered any particular strategies that you or your teams have used as healthcare providers during this COVID-19 crisis that we could share with our other members on the webinar? So I kindly invite you, the chat box will be monitored and we would love to respond to your inquiries in the chat box.
So maybe, Charlene, while they're doing that, I can just mention that the video will be on YouTube and the RGP Toronto website for the slides. The dates of the next webinars are August 18th, the Tuesday, which will be webinar 2 at 9:30 and 4 p.m. And Tuesday, August 25th at 9:30 and 4 p.m. You'll see an evaluation on the SurveyMonkey link, which will be on the slide. I know one of the questions that we had from this morning's webinar was the actual web links that you see on the slides when you receive them. You will just need to click on them. If you require more information, it will bring you directly to the source.
Noticing not too much action in the webinar chat, but I'm sure that we were talking about this morning. We were talking about how stressful it is when people, the families, are more demonstrative, especially when we're trying to check our proximity or closeness. So that was one issue. People wanted to see, how do you deal with that?
I think another question that came up too is, how do you move from the fear zone to the next zone?
Yes.
That came up this morning as well.
Yeah. Not easy answers and questions.
And as you had mentioned earlier on, everybody kind of goes at their own pace as well too.
Yes.
And it takes time to kind of self-reflect and kind of discover where you're at and what kind of resources will actually help you to accomplish the next step.
The one thing I noticed, Thérèse and Charlene, is and I noted this in the very beginning this morning, it's like going to the gym. And I got to tell you, when you start getting into exercising, it's really difficult, or at least I found it to be difficult. Well, self-reflection, I find, is very similar to going to the gym. And starting off is not easy, and you need to really work at it. And being actually mindful is also not easy to work at. And I'm sure, though, once you get going, like going to the gym, it really pays off in droves.
Absolutely. And I'm wondering, Charlene, if maybe you can mention a bit about the journaling kind of and writing your thoughts down. Like, is that a process that takes quite a bit to get started?
So in terms of the mindfulness, I found it very challenging to just slow my mind down to think about my thoughts. But by paying attention, one of the 2 biggest components that I found helpful and that we were taught is just to be non-judgmental with your thoughts. The first step is just to acknowledge what you're thinking and just let it be, no judgment. And over time, what starts to happen is that self-awareness, you're able to stay in the present moment, acknowledge the thought, and then oftentimes put it to the side, which is a skill actually, rather than allow myself to overthink and allow it to replay over and over. And the thought of writing it down and also checking the facts really helps with things like anxiety and fear, because when you check the facts, then you realize that the thought is not helpful or kind. And it's an exercise that you work up to. And again, there's to be no judgment, a lot of self-compassion as well, Thérèse.
Absolutely. And I know one of the things too that's very important is resiliency. And I know in webinar 3 we'll be looking at that. And I think, Tony, you'll be doing a reflective exercise on with regards to that. So that will kind of help with kind of starting into that kind of reflective process.
I really do like what the WHO put out. That was a great little tool, and it really describes the fear zone, the learning zone, and the growth zone. And it's interesting, they didn't necessarily describe how to get through those, which we will do in later, but to at least give you, oh, okay, I can grow and I can learn from all of this. I don't have to stay in the fear zone. And I think that that's why I found that very helpful.
Absolutely. And I think in webinar 3, we'll also be looking at things that we can control and things that we're not able to control, and how we can actually work with it with ourselves to kind of figure out what the balance more or less is for that.
Yep.
So I know another question that came up this morning too is that some staff wanted to share the information that they received, such as the webinars and the webinar slides, as well as the YouTube. Feel free to do that. As you know as well too, you can also view the webinar on the YouTube. I don't know if there's anything else, Tony and Charlene, you'd like to add?
Did we talk about what would be helpful, and if there's any webinars for future if they would like to see? We talked about that, didn't we?
Absolutely, yeah. So they're one on the 18th and the one on the 25th.
Good.
Are there any topics that you would feel as staff that would be helpful to move into the recovery or reopening stage? Maybe in the chat box, if there's anybody that's actually got some ideas with regards to what they feel would help them in the reopening and reopening stage.
Not too much action in the chat box today.
You're a quiet group today.
Warm out there. Hope everybody is in well air-conditioned places.
Absolutely, yeah. Okay. Well, if there is actually no more questions or thoughts, I think we just need to remind everybody that the next webinar, and we would love to actually for you to join us on the 18th and the 25th. I think what we'll do is wrap this up at the moment, and look forward to actually, hopefully you'll join us then. Thank you very much for your time. Stay well.